The problem of healthcare in the Russian Empire became the subject of special concern of Emperor Nicholas II immediately after his accession to the throne. During the reign of Nicholas II, especially by the end of the 1900s, the government began to very thoroughly develop a fundamental reform of healthcare throughout the empire. Commissions were created to analyze all aspects of global reform. Budget funds were allocated, and with the subsequent prospect of a significant increase in funding for the health sector. On January 11, 1897, Nicholas II approved the Special Commission on Measures to Prevent and Combat the Plague under the chairmanship of Prince Ap of Oldenburg, whom the Tsar allowed to use the premises of the Kronstadt fort, Emperor Alexander I, for experimental anti-plague purposes. In October 1897, Oldenburgsky went to Turkestan to take emergency measures to prevent the plague from entering the empire, for which he received His Imperial Majesty's deepest gratitude for the work he had suffered, which saved European Russia and the rest of Europe from the penetration of the plague into their borders. Under Nicholas II, Russian scientific medicine, which could not have developed without state support, received world recognition. For the first time, Russian medical scientists were awarded the Nobel Prize. Physiologist I. P. Pavlov, 1904, and microbiologist I. Mechnikov, 1908. Russian medical science carried out innovative studies of the structure of the brain, stood at the origins of such areas of medicine as forensic psychiatry, gynecology and hygiene. At the beginning of the 20th century, more than 150 general and specialized scientific medical journals were published in Russia. In addition to the theoretical developments of the future reform, a number of very specific measures have been implemented in practice. Their presence is proved by specific numerical proportions. Mortality from acutely contagious diseases during the reign of Nicholas II decreased by more than half. On August 11, 1908, Nicholas II wrote in the margins of the report of the Minister of Internal Affairs, "I draw the most serious attention of the Minister of Internal Affairs to the bleak state of sanitary affairs in Russia. It is necessary at all costs to achieve not only its improvement, but also the correct staging. We need to be able to prevent epidemics, not just fight them. I demand that the case of streamlining the sanitary and medical organization in Russia be developed without delay and submitted for legislative consideration." In March 1912, the Tsar approved the Interdepartmental Commission for the Revision of Medical and Sanitary Legislation, writing in the margins of the Journal of the Council of Ministers, "This is to conduct the matter at an accelerated pace." At the head of the commission was appointed chairman of the Medical Council of the Ministry of Internal Affairs, Honorary Life Surgeon Academician G. E. Rain. In the spring of 1912, the Commission presented its project for the transformation of the central and local bodies of administration of medical and sanitary affairs. Having familiarized himself with it, Nicholas II noted, "Submit to the Council of Ministers. Continue to conduct business in an expedited manner." Nicholas II supported the introduction in the Russian Empire of a territorial system of medical stations, which was then an absolute world novelty. This system was then borrowed by the Bolsheviks and appropriated its authorship for themselves. In the course of the healthcare reform in the Russian Empire, a three-tier structure of medical care for the population was formed: a medical station, a district hospital, a provincial hospital. Treatment in these medical institutions was free of charge. The prevention and control of acute infectious diseases have been particularly successful. If in the period from 1891 to 1895 in Russia an average of 587,000 people died from acute infectious diseases, then for the period from 1911 to 1914 to 372,000 people, therefore, mortality from these diseases decreased by 2.5 times. The opening of new hospitals and medical facilities developed rapidly. In 1912, there were 8,110 hospitals in Russia, to which it is necessary to add 170 psychiatric hospitals. Counted separately, 5,306 medical stations and paramedic stations. In 1914, the empire had 22,772 doctors, 28,500 paramedics, 14,194 midwives, 4,113 dentists, 3,125 dentists, and 13,357 pharmacists. In 1913, 8,600 students studied in 17 medical universities. If in 1901 in Russia 49 million people received medical care, then in 1913 this figure rose to 98 million. These government measures led to a significant decrease in the overall mortality rate, which decreased from 29.4 per thousand inhabitants, to 25 in 1912. The high infant mortality rate in Imperial Russia has long been the subject of speculation. Of course, child mortality in Russia was high, but its comparison with Western countries is not correct enough. Speaking about mortality in Russia, it is necessary to take into account the vastness of its territory, the large number and the predominant agrarian nature of the activities of its population. It is very difficult to compare the situation with the death rate and birth rate in Russia, for example, with the UK. Naturally, 41.5 million Englishmen, as of 1900, most of whom were urban dwellers. By 1920, 64% of the population of England, 40% of Germany and 37% of France lived in cities with 20 million or more people, as opposed to 15% of Russians in 1913. Russian AG population of Russia for 100 years, 1811 to 1913. Statistical Essays. M. Goss, Stat. IZD Vo. 1956. Note: those living in an area of 240,579 square kilometers were incomparably lighter than the 94.244 million Russians in European Russia alone, with an area of 3,960,000 square kilometers, living mainly in villages and inaccessible areas. In addition, the birth and death rates in India, the Crown territory of the British Empire, not to mention other dominions and colonies, are completely ignored. In the same India, only from plague epidemics in 1865 to 1917, 23 million people died. Infant mortality under Nicholas II steadily declined. The downward trend in mortality, both child and adult, began before the revolution. It is categorically impossible to assert the superiority of the Soviet model of healthcare development. In the 1930s, the sanitary situation deteriorated significantly in comparison with Western countries. If we analyze the statistics of the same typhus in the 1930s compared to Europe, i.e. make a comparison using the same methodology that Novoselsky made with the Russian Empire in the 1900s, then the recorded situation will be close to a catastrophe, especially in 1932–1933. A sharp decline in child mortality in the Soviet Union occurred since 1948, when only 84 died per 1,000 children born before the age of 1, 81 in 1950, and 75 in 1952. The explanation for this is simple. It was during the war years in the USSR that the era of antibiotics began. The first domestic penicillin was created. It is the advent of antibiotics that has radically changed the situation with child mortality, and all over the world. There is no doubt that if antibiotics had existed under Emperor Nicholas II, then the picture of infant mortality would have looked very different. Emperor Nicholas II played an important role in the fight against drunkenness. In fact, Russia was one of the least drinking countries in the world. S.A. Novoselsky argued in his study, in terms of per capita alcohol consumption, Russia, as you know, occupies one of the last places among other states. However, the Tsar and Russian society considered the situation with drunkenness in Russia depressing. S.S. Oldenburg wrote that in 1913, the Tsar, during his trip to the great Russian provinces, saw bright manifestations of gifted creativity and labor power. But next to this, with deep sorrow, one had to see sad pictures of people's infirmity, family poverty and abandoned farms, the inevitable consequences of a drunken life. In the year of the celebration of the 300th anniversary of the House of Romanov, Emperor Nicholas II declared that he came to a firm conviction that the welfare of the treasury should not be made dependent on the ruin of many of my loyal subjects. Since 1914, the schools of the Ministry of Public Education have been instructed to teach high school students a course of hygiene with the obligatory reporting of information about the dangers of alcohol. By the decision of the Holy Synod of March 13–31, 1914, it was decreed to establish for the future time everywhere in Russia the annual August 29, on the day of the beheading of the head of John the Baptist, the church holiday of sobriety, with the collection of donations on this day for the cause of combating drunkenness, in compliance with the order of this holiday. By 1913, there were about 1,800 temperance societies in Russia with a total number of members of more than 500,000. As a result of the important decision of the Tsar, serious changes took place in the country, affecting both the private life of people and their health, and the Russian economy. The words of Emperor Nicholas II came true. Sobriety is the basis of the well-being of the people. On August 11, 1908, Emperor Nicholas II initiated the creation of a unified state healthcare system. In July 1914, a few days before the outbreak of World War I, a bill establishing the Ministry of Health was submitted to the Council of Ministers. On September 1, 1916, the chairman of the Medical Council of the Russian Empire, honorary life surgeon, Academician G. E. Rain, who performed these duties until February 27, 1917, was appointed chief manager of state healthcare, as a minister. Thus, Georgy Yermolevich became the first and last minister of health of the Russian Empire.